we delve into recent developments concerning emerging viral threats worldwide. From novel virus discoveries to strategic vaccination initiatives, here's what you need to know. Health experts have spotlighted 4 viruses with the potential to trigger future pandemics: Ebola, Marburg, SARS, and Nipah. In the Democratic Republic of the Congo, a mysterious viral disease has emerged, causing 60 deaths with symptoms resembling hemorrhagic fever, yet testing negative for both Ebola and Marburg. Concurrently, China has reported a new bat coronavirus, HKU5CoV2, similar to SARS-CoV-2, raising concerns about possible animal-to-human transmission. These developments underscore the necessity for enhanced disease surveillance and proactive measures to prevent global outbreaks. The United States Department of Agriculture has announced a $1 billion initiative to combat avian influenza in poultry, which includes the potential vaccination of chickens. The outbreak has affected 166 million birds, leading to a significant rise in egg prices, 53% from January 2024 to January 2025, with an additional 40% increase projected. The plan allocates funds for vaccine research, farm biosecurity, and financial relief for affected farmers. While concerns exist regarding vaccinations' impact on poultry exports, experts advocate for a multifaceted approach to control the virus's spread. Moroccan health authorities have issued an alert following the emergence of an unidentified virus presenting symptoms similar to COVID-19, including fever, persistent cough, fatigue, and severe colds, with some cases experiencing vomiting and diarrhea. Although not linked to the coronavirus, some hypotheses suggest a possible mutated variant. Authorities are conducting tests to identify the virus and have recommended avoiding crowds and maintaining proper hydration. Spain's Ministry of Health is monitoring the situation in coordination with Moroccan officials, adhering to international health regulations to implement preventive and control measures as necessary. The UK's Medicines and Healthcare Products Regulatory Agency has approved Moderna's vaccine for respiratory syncytial virus, RSV, for adults aged 60 and older. Branded as mRESVIA, the vaccine aims to prevent lower respiratory tract disease caused by RSV, which can lead to serious complications like lung infections and pneumonia in older adults. This approval adds to existing vaccines from GSK and Pfizer, expanding preventive options for this vulnerable population. The Wuhan Institute of Virology, previously scrutinized for its research on COVID-19 origins, is planning new experiments on bat coronaviruses. These studies involve modifying viruses to assess their potential to infect human cells, raising biosecurity concerns among experts. The proposed research mirrors activities that some speculate may have contributed to the COVID-19 pandemic, prompting calls for stringent safety measures and thorough investigations into the origins of such viruses to prevent future outbreaks. A newly identified bat coronavirus, HKU5CoV2, has raised pandemic concerns among scientists. Discovered at the Wuhan Institute of Virology, it uses the human ACE2 receptor to infect cells, implying it can transfer from bats to humans without the need for an intermediary host. The virus is related to the merbacovirus lineage, making it a cousin of Middle East Respiratory Syndrome, MERS, which kills about 1/3 of its known patients. Although HKU5CoV2 does not appear as adept as SARS-CoV-2 in utilizing the ACE2 receptor, its capability of infecting human cells sparks concern. Experts suggest vigilance but advise against undue alarm, indicating that the virus's potential to cause a pandemic is uncertain and that Chinese authorities must maintain stringent safety standards. A recent H5N1 bird flu mutation has been identified in a severely ill patient in Louisiana. The virus exhibits mutations that may enhance its ability to infect the upper respiratory tract, potentially facilitating human-to-human transmission. However, virologists, including Dr. Angela Rasmussen, indicate that while these mutations are concerning, there is no evidence of increased transmissibility among humans at this stage. The Centers for Disease Control and Prevention, CDC, continues to focus on containment efforts. The public is advised to avoid handling sick birds, and farm workers are encouraged to employ protective measures to mitigate risks. The human metapneumovirus, HMPV, is causing concern as cases surge, with images of overcrowded hospitals in China evoking fears of a new COVID-like outbreak. Cases are also beginning to rise in the UK. The UK Health Security Agency reports a slight increase in HMPV cases in late December 2024, but overall activity remains at a medium level. The highest positivity rate in the UK is observed in children under 5. The virus, which can lead to bronchitis or pneumonia, especially in babies and the elderly, has been around for decades and is not considered similar to COVID-19 in its impact. Although the NHS is currently under pressure from increasing cases of flu, norovirus, RSV, and COVID, health officials stress that the rise in HMPV cases is expected during winter and is not causing an unusual outbreak. Symptoms of HMPV include those similar to the common cold, with severe cases leading to pneumonia or bronchiolitis. These developments highlight the dynamic nature of viral threats and the importance of global vigilance, research, and preparedness. Continued collaboration among international health organizations, governments, and research institutions is essential to monitor, prevent, and respond to emerging infectious diseases effectively. Stay informed and adhere to public health guidelines to protect